This video is brought to you by the NHS Tayside Children and Young People's Occupational Therapy Service. You may want to go through this training yourself or have a parent or trusted person with you. We hope this training gives you a better insight and understanding of sensory processing and what this means for you as an individual. What is sensory processing? Your sensory system is made up of your 8 different senses, and these take in information from your environment and from within you. That information travels to your brain so that you can make sense of it and help you to complete your daily occupations. Once this is processed, your brain then tells your body how to respond. This happens at a subconscious level, meaning this is an automatic response that you do not have control over. As occupational therapists, we are interested in day-to-day occupations, with occupations being the things that you want to do, need to do, and are expected to do every day. Examples of occupations can be getting dressed, having your hair cut, eating meals, going to the gym, or any activities that we do that have purpose and meaning in our everyday life. All these occupations make up our day-to-day life and the certain habits and routines that we have within our days. All of these occupations can be impacted on by your sensory processing. The job of the brain. The first job of the brain is to keep us safe. The safety brain constantly monitors the environment for danger. This happens at a subconscious level. If our brain detects danger, it automatically responds with a fight, flight, or freeze reaction. For example, this may be experiencing feelings of fear or anxiety and feel like you want to escape or hide, or react in a frustrated manner or feel like lashing out. Or feelings of overwhelm may make you feel frozen, not knowing what to do or how to respond. All these responses are normal and are made at a subconscious level, meaning you don't control this. The example on this slide shows a tiger, and if we were confronted with it, some might fight it, others may run from it, and some may be frozen with fear. The secondary role of the brain is to help us to function. This might be sitting in class and concentrating, or getting dressed, trying new foods, or socializing. The brain needs a range of appropriate sensory information to feel just right and know how to respond to help us to engage in our everyday occupations. But what is really important to remember is that when your safety brain is engaged and there is a fight, flight, or freeze response, it is harder to function when you're in this highly overwhelmed state. The Super 8. You may already be familiar with the 5 senses: hearing, taste, smell, vision, and touch. This sensory information is received from the world around us. However, we also have another 3 senses which gather information from inside our bodies. These are proprioception, vestibular, and interoception. The following slides will go on to explain each of these individual senses. Hearing, or our auditory system, gathers information from our ears about sounds within the environment. This could be passing traffic noise, a phone ringing, music, or a voice speaking to you. Our visual system is when our eyes collect information from visual stimuli in the environment. This could be the things we see, their shape, their size, and their position and changes in light levels. Our smell system is the information gathered from our nose. This alerts us to potential dangers such as gas or smoke. This information is processed near the memory center in our brain and can trigger an emotional response associated with stored memories. Our taste system is made up of the receptors on the tongue and within the mouth, and they detect the different substances we put into our mouth and help make sense of them. Taste, the tactile, and smell systems work really closely together when we are eating and experiencing food. Our tactile system is one of our largest systems. It is not just what we touch with our hands, but it's also experienced through receptors across our whole skin, which detect environmental factors such as room temperature and if things touch our skin and how that makes our skin feel. For example, tickly or painful. Proprioception is related to body awareness, and this sense gets information from receptors in our muscles, ligaments, tendons, and joints, all the bits underneath our skin. It lets us know the position of our body parts and our position in space without needing to look. It is especially helpful for efficient movement and helps with determining the correct force to use. For example, when picking up weights in the gym or when engaging in contact sports such as rugby. Proprioception can have a calming and organising effect on our central nervous system and can actually help override responses to other senses. So it is an important sense to remember when thinking about strategies to help you. For example, wrapping yourself in your duvet may make you feel calm and safe. Our vestibular or balance system is information that the brain gathers from fluid in our inner ear. This helps the brain process different types of movement. For example, it helps to determine whether the body is moving and which way up we are. This system is important for maintaining balance during climbing, jumping, and active sports such as skateboarding. We can also think about different types of movement and the effect that they can have on how we are feeling. Backwards and forwards movement tend to be more calming, whereas rotational and spinning movement is more alerting. Interoception. This sense involves receptors in our organs, skin, and muscles, and tells us how our bodies are feeling. This produces sensations such as hunger, thirst, feeling hot or cold, tired, needing the toilet, feeling sick, pain, feeling your heart beating, or your breathing getting faster. It is linked to our emotional feelings and very important for our self regulation, which is our ability to control the way we feel and act. Although we have talked about these senses separately, it is important to remember that these senses work together to help us to function. If you think back to the slide with the job of the brain, our brain needs a range of sensory information to help us to function, to carry out the things we want to do, need to do, and have to do, and to engage in everyday life. What sensory input do you notice? Now that we have discussed the 8 senses, take a moment to consider the environment around you and what sensory input you notice. What sounds do you notice? Is the room hot or cold? Do you feel comfortable? Do you find yourself chewing on pen lids, your nails, or chewing gum when nervous or trying to concentrate? Are you moving or fidgeting? There is always so much information for us to process, so we rely on a filtering system to sort out what is important to process, and we ignore the rest. Again, this is subconscious and we do not have control over it. Sometimes the wrong information gets in, and we miss the information we should be getting. As occupational therapists, we talk about being in a just right state. This means we are at the right level of arousal to carry out the task or activity we need to do. We fluctuate between calm and alert states throughout our day. This can depend on the environment, time of day, and what is being expected of you. For example, when engaging in a game of football, you need to be energetic and alert to participate. whereas when watching a movie, you are more likely to be in a calm and relaxed state. You may find it more difficult to get into that just right state. This is because your sensory systems can over or under react to environmental cues around you, making it much more difficult to attend to a given task. If your brain is attempting to process too much sensory information, you may feel overwhelmed, putting you into the high arousal level. It may be difficult for you to concentrate and sit still. You may feel like your head is going to burst and you may leave or hide away from the environment or the situation. If your brain is not registering enough sensory information, you would enter into the low arousal level, and you may also find it difficult to pay attention. You may feel sleepy, lethargic, or zoned out. You may feel the urge to fidget or move. It may be challenging for you to initiate a task, and you may find you have missed important information or instructions. Finding the just right feeling. Think about things that make you feel good or calm and give you the just right feeling we discussed. When you have a drink of water, does it make you feel more alert, no change, or calm? What about when you go for a run? Does this make you feel more alert, no change, or calm? Does listening to music make you feel more alert, no change, or calm? Does having a bath make you feel more alert, no change, or calm? This slide suggests some strategies you could try to help you feel regulated and just right. Think about if these would support you to function within your daily occupations. You could try chewing gum, eating spicy food, going for a walk, listening to music, going to the gym, having a bath, watching a film, having a quiet space, go for a run, meet up with friends, have something to fidget with, chair press-ups, bouncing your legs on TheraBand, wrapping yourself in a duvet, wearing different textures of clothes, going out in nature, yoga, meditation, playing a sport, or regular movement breaks. This is our problem-solving tool, which is a little bit like the iceberg analogy, where the tip of the iceberg is the difficulty you might be having, but below are some contributing factors which might be causing the difficulty. It's a helpful resource to sit down and to do with others, and to think about some things you might want to try, as it's often overwhelming to think about where to start. This slide shows an example for you. We have a sensory checklist which is available to download on our website. This can be helpful to give a visual representation of your sensory processing across the different systems and highlights the ones with the greatest difficulties. This will help you with a starting point and where to focus implementing strategies. So this checklist on the slide shows a spike with body awareness or proprioception. So our suggestion would be to try some of the movement strategies from the list, such as going to the gym, doing yoga, or going for a run. There are multiple ways to get in touch with us directly, and please do not hesitate to contact us if you need any advice or guidance with regards to your sensory processing difficulties and your everyday occupations. Within our service, we offer sensory consultations which can be done over the phone or a Teams call with an OT in your locality. These are for you to have an opportunity to discuss with us any specific concerns or occupations that you're struggling with relating to your sensory processing. Your parent or carer can be part of this consultation also. We would advise that you try some of the strategies discussed in this training before contacting us for a consultation, so that you know what kind of strategies work for you.